All right, folks, okay. Thanks for making it up here. Really enjoy that. People have classes here in biosciences? No? You enjoy the mouse elevator? Should we go on? That elevator reeks. It smells like. What's that?
Oh, we took the stairs.
Oh, we go. I'm in shape, and so I take stairs. That's good. It's better. Like someone crawl into the elevator and reeks.
Be in shape to take the stairs.
What's up?
I just pounded down a Chick-fil-A milkshake not too long.
Okay, nice. All right, well, let's jump in and see what questions people have about material up to this point. So, Lauren, I think you said you had a couple of questions. Like, just why don't you start off? Because I know you got it.
Okay, with like plastic conditioning, I was wondering if you could give an example of like higher order.
Classic conditioning, yeah, higher order conditioning. This is good. Remember that when we're talking about higher order conditioning, what we're talking about is once we've got a classically conditioned response. Okay. Once we've got a classically conditioned response, right? We've gone through, and let's say, so the example I gave in class was, let's say that you were in a really bad car accident, right? And you just got in a Starbucks and there was like a coffee in there, and you got in the accident, and that coffee is paired with the injury and pain and fear and stuff like that was involved in the accident. So what might happen is we might see a classically conditioned response to coffee, right? Like, so you smell coffee and it triggers a fear reaction, right? In this situation, the pain and the injury, that's the unconditioned stimulus, right? The fear and anxiety is the unconditioned response, right? Because those two just go together automatically. The coffee was the neutral stimulus. Coffee didn't do anything for you until it was paired with pain injury, and now it's a conditioned stimulus. And now when we get a situation where the smell of coffee triggers fear and anxiety, that's a conditioned response, right? And so that's just our basic sort of classical conditioning situation. But let's say you have a coworker, and in this kind of silly example here, we've got a coworker who always has coffee with them, right? And so every time they come in and are around you, it triggers fear, anxiety, right? But let's say this person has some sort of distinctive feature, like we say it's a mustache, right? What might happen after this gets paired over and over and over again, what you might start to do is when you see mustaches, now that starts to trigger fear, anxiety, because the mustache has always been paired with the coffee. And so we've got a neutral stimulus that's paired with a conditioned stimulus. If that happens enough, what could happen is now that neutral stimulus, the mustache, is now another conditioned stimulus that's going through and triggering sort of fear and anxiety. So we've just layered another thing on top of that. Okay. Now that conditioned response is probably not going to be super intense, but we could start to see that. Okay. So let's take another example. Let's say, think about Pavlov's dogs, right? We go through, ring the bell, they salivate, ring the bell, salivate, things. We've got that set up, right? But let's say now, anytime we're ringing that bell and the dogs are salivating, let's say we add in another stimulus,
Could like
like a flashing light or something like that. What were you gonna say?
I was like, could it be like the person who's ringing the bell, like if they have like a perfume or something?
Okay, yeah. Let's go with that, like a certain perfume, right? So the person who's coming in and every time they're ringing the bell, they have a certain perfume or cologne or something like that. Now, maybe what happens every time the dog smells that perfume cologne, they start to salivate a little bit. That would be a good example of a higher order condition. We're just layering something else. So even though that perfume cologne has never been actually paired with food, the original unconditioned stimulus, is now by association with the conditioned stimulus is now layered on. Okay. Does that help? Okay. It's kind of complex. Do people kind of see how this is kind of layering on with stuff? And this starts to become relevant in sort of things like in my area, we're thinking about like post-traumatic stress disorder. When we've got like sort of maybe certain cues that are associated with a traumatic event, But now every time I get queued up out in the world, because I keep getting queued up, and if there's something else going on every time I get queued up, what can start to happen is I can start to get sort of secondary responses to that other thing, even though that thing had nothing to do with the original trauma. It's just always around when I'm getting queued up. And so now I don't like that thing and trying to avoid that thing as well, right? And so we can start to see things start to layer up. Other questions about higher order conditioning? Or did you have another question? I mean, yeah, or yeah.
I am just like, it also
Yeah.
has to do with classical conditioning
Okay,
and just the idea of extinction.
yeah,
Then what's the difference between the spontaneous recovery that's affiliated with it and
Yeah.
then the reinstatement?
yeah. Great question. All right. So the question is difference between spontaneous recovery and reinstatement, is that right? Okay, spontaneous recovery, this is something, so we've gone through and we've extinguished a response. It's no longer, the organism is no longer responding to whatever that condition stimulus was, and so it's extinguished, right? What could happen though is after some period of time, for seemingly no reason at all, that conditioned response just comes back for some reason. Okay, we don't know why, it just happens. And so this is this idea behind spontaneous recovery. So let's say that I have someone who I'm treating for a blood injection phobia, right? So they don't like blood. So we go through and do a lot of stuff and we get that knocked out, right? The person can go through, they can see blood, they can see images, needles and stuff like that. It's fine. They're feeling good. Treatment was a success, right? But maybe say 6 months down the road, they go through and sort of cut themselves or something like that. And then all of a sudden feeling pain, losing sort of fear response. That would be a spontaneous recovery. There's no reason. It just kind of comes back on its own. Okay. Reinstatement is going to be different. Here we've got a condition return of this condition response after some subsequent presentation of the original condition stimulus. So let's say going back to Pavlov's dogs, right? Or no. Dogs are going to need to eat food. Let's say, like example I gave in class, let's say that so we went through, you got in an accident or something like that. We're treating you for driving anxiety and we got it knocked out. Driving around, you're fine, no worries, things along those lines. And then let's maybe say that you went through and got like a minor fender bender or something like that, something small. But or maybe even a close call. It wasn't even an accident, just something that sort of scared you. And now all of a sudden we're back to sort of that full condition response with things. Okay. So what we're doing is we're subsequently pairing that unconditioned stimulus. Okay. And it happened really, really fast. Okay. So it's, again, the idea is that even though we extinguished that initial fear, because it came right back with just even one sort of kind of minor presentation, now it's kind of back and forth. And then the renewal, this is where we go through and extinguish, but then we take someone back to, let's say again, like the accident situation. We go through, get that driving fear extinguished, and you're doing fine until maybe one day you happen to drive through the original accident site, and now all of a sudden those reactions are back, right, consistently. That would be an example of renewal.
With the reinstatement, would that almost be like generalizing it?
Kind of generalization is a little bit different in terms of like, this is just kind of, let's say I was conditioned to, I was around, I grew up with a sort of a dog, right? And the dog was mean, right? And so let's say it like sort of growled or sort of like aggressed on me and things like that. So I started to get very afraid of dogs, right? But I'm a small kid. But now what I say, in addition to dogs, also let's say if I'm still living out in the country, I also start to get reactions to sheep and cows or sort of other things that aren't dogs, but they're kind of look like they're just large furry animals. Now I'm starting to go through and do that, right? Same thing with, think about the little Albert experiments, right? What we saw is they conditioned him to white rats, but then like you present him with someone with a big white Santa beard, kid freaks out, again, that would be a generalization response. And then discrimination, then being able to discriminate against sort of things. Let's say again, grew up, take the dog example. I grew up sort of had like, so let's say like a Great Pyrenees or something like that, right? Sort of, I'm very afraid of that specific type of dog, but if someone has another type of dog, like I don't get a reaction to that because my fear is conditioned specifically to that. We talk about that in terms of discrimination. Does that help? Should I tease that out? Okay. Yeah.
Say a CR goes extinct after 8 months.
Yeah.
If it were to come back, would it take another 8 months? Could it take longer? Would it take less time because you've already gone through the process of having?
Yeah, no, that's a good question. So so the idea with these renewal types of things is that it doesn't take that sort of amount of same time to go through and renew. So let's say and so this may be most apparent with reinstatement, right? Let's say what happens is we take Pavlov's dogs and we extinguish the salivation response because we just ring the bell, ring the bell, ring the bell, never give them food, right? And so they stop salivating. But then like one time we go through and someone while I'm feeding the dogs, there happens to be a bell go off or something like that. Now all of a sudden they're back to consistently salivating. It would have taken a lot of time to go through and condition that response, but with reinstatement, it happens real fast. It's all of a sudden like sort of back to where we started, right? Again, suggesting that conditioning trace is still in the brain, and it just took something minor to go through and reactivate it, and now we're kind of sort of back to where we're. Does that help? Awesome. Other questions? Yeah.
Could you kind of, in like the comprehension check of the classical conditioning one, you talk about like the, informing the understanding of various like psychopathology.
Yeah.
Could you kind of like go over that a little bit more?
Yeah. So again, the question is, for this, how do principles of classical conditioning inform our understanding of various forms of psychopathology? We didn't talk about this a ton in class, just kind of through some examples and things like that. But again, this is something kind of very near and dear to me because it's sort of the area I study, right? And thinking about for like trauma related stuff, right? We see classical conditioning doesn't account for everything, but it accounts for at least some of what we see, right? Where someone has gone through and had like a really intensive traumatic experience, and now things that are sort of associated with maybe that trauma experience are triggering sort of fear, anxiety, sort of emotion and stuff like that. There's lots and lots of other stuff going in why we're seeing that, but it's an example, okay? Specific phobias, right? We talked about in class. Like if we go to like old school, like dynamic Freudian like types of things, like the idea is like we have phobias because there's some trauma in our past. That's actually not the case. People have phobias just because they have phobias for no real reason at all. But we certainly can have phobias that sort of are or are related to some sort of problematic event. Like so, let's go through and say that you as a young child sort of got too far out in a lake and sort of had a scary experience. And now you're terribly afraid of water. Like anything that starts to get up here, you start to get real worried about, right? We would talk about and think about that as maybe a classically conditioned type of response. Things like panic disorder, okay? If you've ever had a panic attack, which is not uncommon, people have panic attacks all the time. What we see with panic disorder, though, and agoraphobia is people start to avoid things that sort of start to trigger those panic types of sensations, right? So we talk about walking up the stairs, right? If I had panic disorder, walking up the stairs, if it started to get my heart rate going, that would be really, really uncomfortable. So what I would start doing is start avoiding things that might trigger sort of increased heart rate or sort of like increased breathing or things like that. Not that you're having a panic attack, but those things feel like a panic attack. And so what I start to do is avoid those things. I might not drink caffeine or things along those lines because I've associated that with something different, right? So these are just some examples of ways in which sort of these classical conditioning responses start to go through and develop and inform a lot of like anxiety related pathology. Does that help kind of sort of put that together? Okay, cool.
Does that go into the discrimination, or is the discrimination more of like an unconscious thing? Or are you like consciously trying to avoid it?
A little bit. So I think the thing with panic and discrimination, that's actually really, really helpful because that's one of the things that we're trying to do.
So you can consciously do like
So you can recognize, like, hey, this is something different. This is not something. Now, people aren't always aware of why they're afraid of certain things and not other things, right? But in treatment, what we would do is, Jordan, yeah, if you were struggling with some panic stuff, you're seeing me for treatment, what I would do is I would have you walk up and down the stairs, put you in a chair, twirl you around and things like that. So you could experience those sensations and recognize that, hey, these are not comfortable necessarily, but they don't mean I'm having a panic attack, trying to decouple that sort of the, and this is where we get into anxiety stuff. The problem is overgeneralization of stuff, right? Here, and think about trauma, like here, sort of this happened, and so I got real upset, and so it's because it was a scary, scary event. But now I'm reacting to things that aren't scary. They're safe things, but I'm sort of reacting to that, sort of trying to reduce the generalization of that, sort of increase discrimination through some of the techniques. So now this happens sort of kind of on its own, right? If I don't like some things, I react to, let's say I'm terrified of spiders, but then also like other bugs kind of creep me out. They're starting to see a generalization, or like I'm terrified of spiders, but centipedes I'm fine with, or sort of other types of bugs don't sort of trigger me, right? And then we would talk about that as a discrimination response. Good question. Other stuff with conditioning. Yeah.
Or something.
No, keep going.
This is operant.
Okay, yeah.
I was just wondering if you could kind of clarify negative punishment
Yeah.
a little more specifically.
Okay. Some things to remember with reinforcement and punishment. Operant conditioning gets tricky. Classical conditioning is actually pretty straightforward. It's sort of the same kind of formula. Okay. Operant conditioning gets a little bit trickier because what we need to remember is first identify the target behavior. What is the target behavior? And remember, target behavior is always something the organism is doing, not doing, right? So what is the target behavior? And then thinking about from a learning perspective, are we trying to increase the frequency of that behavior or decrease? If we're trying to increase, we're working with a reinforcement schedule. If we're trying to decrease it, we're going to work with a punisher schedule. Okay. And remember that within operant conditioning world, positive just means giving something, negative means taking it away. Very, very, very important. Now, oftentimes the positive thing, the thing that we're giving, at least in terms of reinforcement, is something that is nice, that will work for, right? But it doesn't have to be. Okay. Let's think about if I've got it, and again, sort of thinking back some of my wife's work with kids and stuff like that. You got a kid in a classroom who's being disruptive, right? Who's not sort of paying attention, causing problems and things like that. And so what I want to do is I want that behavior to decrease, right? So I'm trying to find a punishing. So the target behavior is disruptive action or something like that, right? And so what I want to do is I want to decrease that target behavior, okay? And so I'm talking about a punisher schedule. So what I do is, I'm sorry, what's your name? Man?
Rowan.
What's that?
Rowan.
Rowan. Okay. Rowan, let's say that you're the disruptive kid, right? And I want you to decrease that behavior. So I'm looking on a punisher schedule. And so what I'm going to do is I'm going to yell at you, right? And so in my mind, what I'm going to do is I'm going to yell at you to decrease the target behavior. What are we talking about in terms of operant conditioning? What do I think I'm going to do here with this? What would that be? If I yell at you to decrease a target behavior, what are we talking about?
You're reinforcing it because he's getting the attention.
Well, hold on. We're not. Let's look at like what I'm trying to do. What I'm trying to do with this is going to
Decrease
be.
his behavior.
What's that?
You're trying to decrease his behavior.
Trying to decrease his behavior. So we're talking about a punisher.
But you're yelling at him.
Yelling at him, so I'm
it's a
giving.
positive
So
punishment.
it's a positive punishment, right? That's what I think I'm. Yeah, you got it. That's what I think I'm doing, right? So I'm going to use a positive punishment schedule with Rome because I'm going to yell at him in an effort to decrease the target behavior. But what? Yeah.
Do they find negative punishment or positive punishment like more credible, I guess? Like, do like people think like one works better than the other?
Not really, it just depends on, you gotta be you gotta think carefully about how you're going through and implementing these. I don't know that any of these sort of work sort of necessarily better on sort of in general than something, but it needs to kind of fit with what you're doing a little bit, yeah.
Is it just
So-
like dependent on like what, I guess whoever's getting the punishment, what they're looking for, like when they're like expressing that behavior?
And yeah, right, so if, let's say that I go through and I start yelling at Rowan every time he's acting out, right? But what happens instead of that behavior decreasing, that behavior increases, okay? Is my yelling then a punisher? No, by definition, it's not, because if it was a punisher, it would reduce that behavior. What might be happening is actually what I'm doing is I'm providing positive reinforcement for that behavior, because if I'm giving him something and that behavior is increasing, then by definition, it's a positive reinforcer, right? Now, what I might do if I sit down and think carefully is maybe Rowan is just wanting attention, right? Rowan is acting out, and when he does that, I go through and I yell at him, which is attention. It's not good attention, but it's still attention, right? And so then it's going to perpetuate that behavior and keep him going, right? And so this is why when we're actually trying to implement this in an actual situation, need to be very careful and be like, okay, here's my plan. Here's what I think I'm going to do. But then you have to put it into practice and see what's actually happening. And then you have to go through and sort of say, okay, well, that's not working. It's actually making things worse. Something I'm doing is reinforcing that behavior. What is it? Can I go through and change things around and go through and do something? So here in this situation, if I'm seeing that what Rowan is working for and what's reinforcing for him is attention, then maybe I can go through and change my strategy to go through and try and reduce that target behavior. And so maybe and this is where we start to switch things around. Maybe instead of trying to reduce a target behavior, I instead focus on something I want him to increase, right? So let's say sitting quietly is what I want him to do. And this is often how this works. So now, Rowan, instead of yelling at you, if you're out sort of messing with other people, when I see you sitting quietly, like, hey, Rowan, thank you very much. You're doing awesome, man. Thanks for sitting there carefully, right? And like, oh, wow, I just got attention. Or sitting quietly is the behavior, right? And that's what I want to go through and reinforce. And so now maybe as we're going through every couple of minutes, I notice you're still sitting there quietly, like, hey, really like what you're doing, man. Nice work. Blah, 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 blah. Really good work. And so now I'm going through, I'm getting the same thing, but instead of, I'm sort of taking a different approach. I'm reinforcing a behavior I want to see, not worrying about trying to reduce the sort of behavior that he's not, right? So I could also go through, if I wanted to focus on a punisher schedule, I could say, all right, Rowan, you're up and you're running around being disruptive. I want to decrease that. I'm going to take away your recess, right? So I'm taking something away from you. I'm going to put you in timeout or something like that. That could be a different way to go about it, but really just kind of depends on the individual and what which motivators are stronger for things. So it's really tricky, but for the purposes of what we're doing, just always remember that once we've identified the target behavior, we're doing something to increase the likelihood of that behavior. We're talking about a reinforcer. We're talking about something that reduces it. We're talking about a punisher. Positive just means giving something. Negative means taking it away. And that's because people will get tied up with positive and good, negative, bad. Not in this circumstance. It's just giving versus taking. Does that help sort of clarify some of the stuff? So positive punishment. We talk about like corporal punishment, like spanking and stuff like that. That's positive punishment. Grounding, timeout, things like that. That's sort of negative punishment. Again, just to give some routines. Other questions? Go for it.
On the last question on the comprehension check
Yeah.
on this one, it's about like prepared and counter prepared.
Oh, whoops.
Is that
I pulled that out. You don't need
Okay.
to worry about that. Yeah.
cool?
No, that was some material and interesting stuff. There's certain things that are easy for people to learn, and there's certain things that are difficult for people to learn, right? If we think about conditioning, like nausea with taste, that's super easy to do, right? Because we're kind of wired and prepared to do that, right? If we tried to pair nausea, feelings of illness with some like visual type of thing, that's hard to do. Our brains aren't wired to make that association, right? And so this is just getting at things that we're wired that are pretty easy to pick up and stuff that's harder to train. That's what that was about, but you don't have to worry about that because I cut it out of here. Good catch, thank you.
You go through the fixed radio schedule and the intermittent
Yeah,
reinforcement.
absolutely, yeah. Okay. So for our reinforcement schedules, okay, remember that if we're going through and we're trying to train a behavior, we're trying to reinforce it. Try and reinforce behaviors. Continuous reinforcement, this is the best way to go through and acquire a behavior, right? Because if I go through with continuous reinforcement, remember every time sort of the organism or whoever I'm trying to train, every time they engage in the behavior I'm wanting to see, I provide a reinforcement. Okay. So let's say I'm trying to, we'll go back to Rowan and pro-social behavior in the classroom, right? So let's say, Rowan, every time I see you help a friend, I say, hey, nice work with that. Hey, I really appreciate the work that you're doing. Or I give you a star or something like that. I sort of give you a reinforcer. And every time I see you do that, I go through and give it. Pretty soon, what's going to happen? You're going to say like, hey, like I might go through and help people out for pro-social reasons or just because I get paid for it. But like, hey, I'm going to go through and continue to do this, right? So we've got a continuous reinforcement schedule. This is a really good way to go through and acquire behaviors really quickly, okay? The downside is with continuous reinforcement, if I stop giving you stickers or stop giving you praise, probably what's going to happen is that's going to extinguish pretty fast, okay? So this is where we get into intermittent reinforcement. Here we can start to provide really durable types of behavior. And with intermittent reinforcement, we're not reinforcing every time we see the behavior. It's according to some different type of pattern. Okay. So we've got two different types of schedules here. Okay. If I'm talking about a ratio schedules, I'm reinforcing based on some number of behaviors. Okay. If I'm talking about an interval schedule, I'm reinforcing based on time. So really important to distinguish those two. Ratio means after some number of behaviors, I'm going to go through and provide a reinforcement. If I'm on an interval schedule, it means after some period of time, provide a reinforcer. Okay. And then we just have whether or not it's fixed or variable. Fixed means it's the same every single time. Variable means it's completely random, it just jumps around. Okay. So for my fixed ratio schedule, I'm going to go through, I'm going to provide a reinforcer after a certain number of responses. Okay. Let's say it's 5. Okay. Going back to Rowan, every 5th time I see you go through and help a peer, I'm going to say, hey, nice work. Here's a gold star. Another 5, here's a gold star. Another 5, here's a gold star, right? It's based on the number of observations. Now, if you don't help anybody for 7 hours, right, you're not going to get reinforced because I'm not seeing that behavior, but every 5th time I'm going to go through and reinforce. Okay. Variable ratio, still going to go through and reinforce, give you a gold sticker for helping somebody. It's just, I don't know how many times it's going to have to happen before I go through and reinforce, right? Here we're going to go through, maybe it's 1, you help someone, here's a sticker, 2, 3, 4, here's a sticker, 5, 6, 7, 8, 9, 10, 11, here's a sticker. It just kind of jumps around, okay? Same thing with a fixed interval. Here what I'm doing is so long as you're in the classroom and you're helping out and being cooperative with other folks, right? On a fixed interval, maybe I go through and every 2 minutes, I say, hey, Rowan, really nice work. I really like what you're doing. Keep playing nice with other people, blah, 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 right? 2 minutes, hey, nice work. I really like what you're doing. I got to keep an eye on the clock. Yeah, every 2 minutes, I'm going through and providing reinforcement, right? So in between there, you're going to go through and sort of be helping people out. You know, I'm not going to say anything to you, right? But every 2 minutes, so long as you're sort of being cooperative, you're going to get reinforced, right? Now, if we turn it into a variable interval schedule, that's a little bit different. Now I'm still going to go through, so long as you're sort of cooperating with your peers and doing stuff like that, I'm going to provide a reinforcement. It just might be sort of after a minute, and then maybe after 5 minutes, then maybe after 30 seconds, then maybe after 10 minutes, right? That time frame is just gonna jump around. But so long as you're interacting in appropriate ways with your peers and things along those lines, I'm gonna continue to provide reinforcement. It's just on a variable time frame. Okay, so in that time frame, you could help out a peer 7 times, you could help out a peer 2 times. Doesn't matter, so long as you're still interacting with people and doing what you're supposed to be doing, I'm still gonna provide that reinforcement. Does that help, Karina, in terms of sort of those? So again, here, remember, ratio means number of observations or number of behaviors. Interval means time, and then fixed just means the same every single time. Variable means it kind of jumps around. Okay. And what we find here is that we see different types of patterns of behavior based on the type of reinforcement schedule. Anything that's administered on a ratio schedule, we tend to see higher rates of behavior with ratio. And which makes sense if we think about it, because you're being reinforced based on the number of target behaviors, okay? And as fast as you go through those target behaviors, the faster you're gonna be reinforced, right? For a fixed ratio, it's gonna be every 5, right? So I'm gonna just, as fast as I hit that lever, I'm just gonna get food pellets. But even if it's a variable ratio, right? I'm still, the faster I hit that lever, the faster I'm gonna get reinforced because it's based on the number of behaviors, right? So we see more higher rates of reinforcement there, okay? What we tend to see though is more durable behavior that persists longer when it's on a variable ratio or on a variable schedule, okay? If I'm going through and I know that every 2 minutes I get a gold star, or I know that every 5 times I press the lever, I get a food pellet. If for some reason the reinforcer stops, never to come again, I go through and press the lever 5 times, no food pellet, another 5, no food pellet, another 5, nothing, another 5, all right, I'm gonna give up, right? Or if I know every 2 minutes I get reinforced, right? So Roman's there and he's expecting about every couple of minutes to get sort of a reinforcer, so long as he's playing nice with people, right? You might see you would see something like this, right? Where as we start to get to about 2 minutes, you start really helping people out, and then you get reinforced, and then you maybe back off a little bit, and then you get closer to 2 minutes, start pick up again, and then kind of back off. But if I still go through and I'm gonna ignore you for the rest of the day, and I'm not gonna give you any gold stars, 2 minutes go by, you're looking around, waiting for reinforcement, back, all right, well, it's gonna kind of go through another 2 minutes, back, okay. Pretty soon you're gonna realize I'm not sort of providing you any reinforcements anymore. So you're gonna probably sort of turn off, right? When we go through, we have a variable schedule, though, we don't know how often we're gonna get reinforced. It might be after 5 presses, it might be after 2 presses, it might be after 50 presses, right? Thinking about this in terms of slot machines in a casino, right? That's gonna be a variable ratio schedule, right? This is based on the number of pulls. I just don't know how many pulls I'm gonna have to get in order to win big, right? So you see very, very, very durable, long-lasting behaviors if we're using this variable ratio type of schedule.
Do you usually can combine them, this type of reinforcement, or do you stick to?
You
For the
could, right? Usually, so if you, and we think about there's a difference between trying to train behavior, right? And then just kind of what happens naturally, right? Like probably if we're thinking about the kiddos or sort of partners or let's say like you got a roommate who's like trying to go through, you want your roommate to clean up the house because they don't clean up after themselves, right? But then they do, and you're like, hey, or nice work, and so you clean up the house, right? And then I'm probably not gonna go through and like have like a schedule where I'm gonna go through and tell you nice work. It's probably gonna happen sort of probably on this variable interval schedule. Like when I think about it, I'm like, oh, hey, sort of nice work. You might have cleaned up the house twice or 7 times. It might have been, yesterday or 3 days from now that I'm going to go through and provide. This is probably what happens kind of organically, right? But this is still a sort of a good kind of variable sort of thing. Maybe you start to get a little bit messy. You're like, oh, I really don't, but then you got a room and like, hey, really appreciate how you're doing with helping out. Okay, now I'm feeling good, but now I'm kind of back in it, right? So probably this is most often, kind of how things happen organically. But if I'm someone who's trying to go through and work with somebody, or so I'm doing sort of different types of training and things like that, sort of behavioral analysis types of things, want to be maybe a little bit more mindful in terms of how I'm going through and setting things up. Right? And if I'm sort of so professional, like working with like teachers, instructors and things along those lines, helping give them some structure so I know if I'm working with someone who's a consultant, how often do I need to be reinforcing Merlin for doing the thing? What am I going to do on what schedule? Things along those lines helps keep me accountable, and then also sort of helps sort of with that training piece of things. Does that help sort of getting sort of those different schedules? A good thing, definitely know this and how these play out to the characteristics of syllabus. All right, other stuff, all great questions. Yeah.
I was wondering if you could, you posted like that announcement of like the ChatGPT like questions.
Yeah.
and Scenarios. Like for me, I could like, I study enough to where I can tell you the definitions. I just have a hard time putting it on the problem.
Okay.
I was wondering if you could like go through maybe one of the problems on that ChatGPT.
Yeah.
And then like
Yeah.
show us how we could identify what's on the question too.
Yeah. Let me see.
Yeah, because I'm like, that goes into like changing this information of that. Yeah. And how you could change this to this is extra dollars. I think I'm curious, because I can't walk. Something gives you like she call that. Yeah. I feel like I get like that sound. I think that's only way good. Yeah. They're just okay.
Okay. Well, do you want to, you just want me to kind of walk through some of these questions, kind of explain?
Definitely the scenario ones and how, what we can identify. Like,
Okay, cool. So, if we, excuse me. So this first one, we got. And I would definitely go through and do this and sort of go through and sort of pull out, these are the types of questions I'm asking. You'll want to know how to do this, right? So here we've got Sarah's dog Max gets excited, runs the door every time she grabs his leash because he has learned that the leash means he's about to go on a walk. One day Sarah picks up the leash but doesn't take Max outside immediately. Despite this, Max still gets excited and runs to the door. In terms of classical conditioning, what is the conditioned stimulus in this scenario, right? Now, a dumb computer gave us this and it's not that great of an example, okay? So what I don't like about this is that, remember that with classical conditioning, we're talking about a reflexive response, right? And I have a hard time thinking about like going out for a walk. Like what's the, I guess in this example, the idea would be the unconditioned stimulus would be like taking the animal like towards the door or taking them outside, and then excitement of being outside, I guess, but it's a pretty flimsy, it's, the elements aren't super there, right? But if I accept the premise that sort of this kind of fits into the thing, like the idea is that taking the dog outside generates excitement, right? But every time I take the dog outside, I have the leash. So the leash in and of itself is nothing. It's just a strap of leather. It doesn't mean anything, right? But if I pair that repeatedly with going outside, eventually what might happen is if I grab the leash, the dog associates that with going outside and gets excited, okay? So when the answer is, okay, so what is the conditioned stimulus? It's gonna be the leash, right? Because remember, the stimulus is something that sort of like something or some cue or something along those lines. The response is what the animal does. And so here the idea being that the leash is something that was neutral, but because it's been associated with going outside, it's now become a conditioned stimulus. It was neutral, it's now become a conditioned stimulus. The conditioned response then is the excitement of the dog anytime it sees now the leash, okay? So that's kind of the idea. It's not a great question, but still, if you got it, you could probably work through and sort of kind of figure it out and it would be fine-ish. Sorry, Anthony, I'm saying it your way. You kind of see sort of what that's, where that idea is coming from?
Yeah.
Okay. And then, okay, let's find one that I did like. Okay. Toddler sees a doctor wearing a white coat and gets a painful vaccine. Later, this child starts crying whenever they see someone wearing a white coat, even at a store, okay? This is an example of generalization here, right? So here the idea being that, get out of Anthony's way, the idea that we do have here a classically conditioned response, right? We've got the pain of the injection resulting in sort of fear, anxiety, right? And the white coat is just something that's been sort of associated with that. The white coat doesn't mean anything, right? But when we take the white coat and we pair it with the pain, that white coat now on its own will solicit a negative sort of a distress response. And so we would say that coat has been the conditioned stimulus, the crying, the distress in response to seeing the white coat, that's now your conditioned response, okay? Now, in this situation, what we're saying is now that white coat of the doctor has been generalized to other white coats. So now this child, if it's going through the store, sees someone with a white coat, now gets upset still. And so now we've seen a generalization response. So this is actually a really nice example here. Up here, after being bitten by a dog as a child, Maria now feels anxious whenever she sees a dog, even though she hasn't been bitten again. What's the conditioned response? It's going to be feeling anxious, but feeling anxious specifically in response to sort of seeing the dog, right? Because the dog is neutral until the dog is paired with the bite, the injury. Now that dog was a neutral stimulus, it's now become a conditioned stimulus, and the conditioned response is the fear, anxiety, specifically in response to the dog. You want me to go through some more of these? Please. Okay, yeah.
So I see that you posted this on Canvas, but
Yeah.
can we see kind of your comment? Like you can't see your comments on the side.
Okay, here's the thing, right? What you need to do if you go on Canvas is actually
Can I just see the answers? I don't know what questions you think are like bad questions or which
Yeah.
ones.
you do this a couple of different ways. If you go to announcements, you go to the announcement. And then you click on this. And download this as a Word document. If you then go up and open it up, that will show up, okay?
Okay.
You have to pull it up as a Word document, and then that will go through and pull up. The other thing I think you can get there, if you go to files, there's this weird unfiled folder right here. Yeah, and this is where these are living here. You can go through and click that,
Oh, okay,
and it should, yeah, kind of pop up there as well.
thank you.
Okay, yeah, no worries. Yeah,
Question.
yeah.
For the common disruptors, can we again, talk about the difference between retroactive interference? How do you recall new information, no, how it interferes?
Yeah.
The new information with the old information?
Yeah.
And there's two types, right?
Yeah. So if we go to, oops. Proactive and retroactive interference. Proactive interference, this is interference of prior learning on new learning, right? So if you think about proactive interference, and again, this is back to sort of my arm movements here, right? Like I say, old stuff interfering with new stuff, right? So proactive, old stuff interfering with new stuff. Let's say, you grew up in a Spanish speaking home, right? And then sort of go to school where sort of English is primarily spoken, you sort of acquiring that language. So the Spanish language information is influencing and impacting your ability to remember English words because like the old stuff is kind of interfering with the new stuff. Okay. Best example, thinking about you change your password or get a new phone number or something. Yeah. That old memory of the password, the phone number, things like that, impacting your ability to pick up and memorize the new stuff. Okay. Retroactive interference, this is new stuff impacting your memory of old stuff. Okay. So this is going to be, again, like all the stuff that you're learning right now. So kind of piling on and sort of obfuscating and sort of mucking up sort of things that you learned at the beginning of the semester, right? So you kind of going through and learning about sort of new things. This is a good example of this. So I talked about this at one point in lecture, like one thing in terms of studying, right? Some things that we can do to sort of make studying sort of more effective. One, spacing things out, right? Is then we get less of a reduction and sort of immediate loss of information. But the other thing too is you can think about from a memory standpoint, going through and sitting down and studying and sort of working on some stuff, and then going right to bed, right? There's a couple of things going on. One, we know that sleep helps consolidate memories and things like that. So if I'm sort of going through and studying, and I go to bed, get a good night's sleep, that should help, right? But the other thing too is if I'm going through and studying, and then I lay down and go to sleep, what I'm doing is I'm preventing sort of retroactive interference here, okay? Let's say you go through, you're studying psychology and stuff like that, and you're like, I'm gonna go out and watch a movie with friends, or I'm gonna go out and do this, that, or the other thing. There's a whole lot of other things that are going on after you were studying that could potentially go back through and sort of interfere with the other stuff that you were going through and impacting. And so again, like the idea of like, okay, I'm going to set this up. I'm going to go through study and then crash out, hit the sack is probably a good strategy for sort of preventing